James, welcome to Africa 54.
Thank you, Mr. Paul.
You recently quit your job and decided to venture on a new journey. You started a new health center to help you people in the communities where you come from. Bring me up to speed. What is it that you've been able to do?
I'm always driven by passion. With my background as a medical personnel, and with the background of my own community where I hail from and where I'm born, the Western Rural District of Uganda, called Kitagwenda District, because of the poor health, the rural health care is really so much demanding. The increasing mortality rates, the fatality rates, caused me to have that passion and inspiration to say, let me do something for my community. Let me do something so that our mothers can survive and thrive with their babies. Gertrude Memorial Community Center, the name Gertrude was my mother, who actually is one of the people who suffered those consequences of the poor maternity services.
What are some of the things that you offer at that facility?
Number one is free services for HIV counseling, testing, and guidance. We have free ambulance services for the most ill patients from our rural village, the biggest facility that is very many kilometers away from here. We offer free self-made circumcision services, and then we offer affordable and available services and mental care that I'm telling you. We do the deliveries of mothers. We do family planning services.
I can hear some babies crying in the background. Do you just have like a kid delivered or something like that?
No, those are they're just in the ward, in the pediatric ward just behind me.
Where is like the nearest maybe government center or hospital where people can go other than your facility?
So someone has to travel for about I think about 15 to 30 kilometers to access a health center for level hospital. In the Ugandan setting, a health center has a medical officer as the main manager.
James, when you talk to some of the patients, people who have come to your center, what are their stories? What are their challenges?
The biggest story that I can report to you on a positive note is that the people have found it as the most accessible, valuable, affordable, and yet compassionate. People coming in very hard conditions, very ill, and within 24 to 48 hours, we discharge of a person. They go back there in the village and they're like, you know what, guys? Gertrude Memorial is the real deal. And on a negative side is that on the part of the facility, because of the reason that the services are very subsidized, very low, we are battling a challenge of we bring in drugs and other supplies and they immediately get consumed, and yet the return is very low.
Ultimately, what would you want to get out of something like this? You're talking about some of these challenges that you're facing. You are a new startup. How can people help you achieve that dream?
All the Voice of America followers and the fans, and those ones who have passion for health care, basically rural health care, maternal child health, palliative care, nutrition is number one. If there is someone out there who is willing to come and be part of us in volunteering with us, that would make a big deal because it would mean human resource-wise we would be sorted. That is one. Two, we would need someone who would be there and is like, you know what, James, what are you lacking in your maternity wing? What are you lacking in basically as an equipment so that we give you something as an equipment-wise? Someone could still come in and say, you know what, James, let me take over your maternity, because the biggest challenge in this community is something to do with maternity.